Whoa. If you're having balance issues, balance difficulties, and you were just recently injured in a car crash, you're going to want to listen to this. All right, let me show you what we're talking about here. This list of red symptoms are all the symptoms that are associated with a spinal instability or ligament laxity. You can see there's about 20 to 1 versus the blue column. The blue column is only disc injuries, herniations, bulges. Sometimes these are picked on MRI, but a lot of times they're missed. What's missed even more on MRI are the red symptoms, or the ligament laxity and the ligament instability. Over 30 to 40% of actual tests that are properly done will come back with positive findings for ligament laxity and ligament instability. So that begs the question, what's the test and why isn't it being done? More on that later. Just know that we know the right tests to do, and when you come into our facilities, we're performing these specialized ligament tests. We're not just looking at the MRI. Especially because there's many reasons why the MRIs are horrible to do. And if you leave a comment, I'll give you an ebook or a guide that shows you the top 3 reasons why the MRIs fail and why they're not a good reliability. What we want to focus on are the actual spinal units, and let me show you what these ligament injuries look like. So if you look at all the red here in this picture, you can see there's a lot of red ligaments and there's only one blue. The disc is the blue ligament. Over 220 specialized ligaments that can be and are damaged during a car crash or some type of major trauma. But the main thing is that you want to get these properly assessed and then diagnosed and then put into your legal case. You also don't want to miss these injuries, because then you end up seeing me 10, 20 years later with injuries so severe that they might only require surgery and you might not be able to get rid of these symptoms. Just to reiterate, the places that these injuries are not picked up, you're not going to get this done in the hospital properly or the emergency room. Most likely the doctors aren't trained to pick up these injuries or even understand what they are as well. And it's not going to happen by your radiologist either, because they're not going in and they're not actually measuring the injuries, because this is a measured phenomenon. Whenever you do have these injuries, they may qualify for surgical fusion guidelines or guidelines like the AMA, the American Medical Association. Another key thing to note is that if you do have these ligament laxities or this ligament instability, it makes the disc herniation worse. So you definitely want to get these picked up and assessed so that you can properly treat them, because it is going to change your treatment guidelines as well. Once you have a properly performed ligament analysis or a ligament report, then you can take the next proper action, which is getting the right treatment. Fix the spine and the structures around it. This may include things like pain management for injections for the pain, at least in the beginning phases, to lessen the pain so that you can actually begin to treat it properly. It may also include surgical consults, and in some cases, unfortunately, it does require surgery. Other key things